Okay, just wanted to go through the last part of the chapter 18 notes here a minute, so you can pick them out. Wow, that's some really bad glare. So we're on the bottom of page 5. We've looked at really the causes of schizophrenia. We looked at the dopamine hypothesis, for example, where too much dopamine is going through certain dopamine pathways and creates these, what we call the positive symptoms of schizophrenia, which include thought disorder, disorganized thoughts, irrational thinking, hallucinations, delusions. So a hallucination is when you like hear voices. That's a hallucination. You're sensing something that's not there. You see something or hear something that's not there. A delusion is when you have some sort of belief that's contradicted by reality. You think people are out to get you, or you have some delusion of grandeur, like in Ellen Sachs. Yeah, she had delusions and hallucinations if you listen to her talk. So we also looked at the role of the central amygdala, which had to do with if there's too much dopamine in the amygdala, it can cause you to be too fearful of people's faces, for example. Anyways, let's look at treatment now. So I asked you to read this article about different drug treatments for schizophrenia, and they talked, the first one there, chlorpromazine, was kind of one of the first drug that really came out to treat schizophrenia. And now we know that it's a dopamine antagonist. So you might be wondering, what does that mean? So DA in your notes stands for dopamine, the neurotransmitter. So you might be wondering, what is an antagonist? Well, like in literature, an antagonist is someone who fights against the lead character, like Roger Chillingworth in The Scarlet Letter, for example. But in drug talk, an antagonist is, so this is a dopamine antagonist. So what it does, the drug will bind with certain dopamine receptors. I believe they're the type 2. And what that means is not as much dopamine is going through your brain through that pathway. The mesolimbic pathway. Sorry, yeah, I think that's the right one. And so that treats the positive symptoms. So what they found is that there's certain other drugs like cocaine and others that activate your dopamine receptors that produce the same sort of positive symptoms as schizophrenia. So delusions, hallucinations, etc. So this drug, chlorpromazine, gets into some of those dopamine receptor sites, so not as much dopamine is being transmitted neuron to neuron, which eventually will weaken the signal and cut that reaction. Won't have enough for another action potential. So that was kind of the groundbreaking drug for treating schizophrenia for quite a while, as you read. And there was another one in there too, started with an H, haloperidol, but I didn't put that one in your notes. Then later they developed, well, all these drugs have side effects, right? And they're not effective. I think it said in the article that 1/3 of patients that were treated with these drugs didn't have any noticeable difference or didn't get better. I underlined it, but I can't find it. Okay, it's on page 5 in that printout. It says that about a third of patients obtain no benefit from either chlorpromazine or haloperidol. So that's very discouraging, right? I thought there was one other piece here I thought was... Oh, I thought I had one other thing underlined here, sorry. Oh, just looking at how, yeah, that chlorpromazine is blocking these D2 receptors in the mesolimbic pathway, which curbs the overactivity, reducing those positive symptoms. But then later they developed these what are called atypical antipsychotic drugs. And they're atypical because of the way they work. So the one there, Clozapine, decreases the amount of dopamine in the mesolimbic pathway. So that's very similar to how chlorpromazine works, which reduces positive symptoms. So it has that same type of thing. But the other neat aspect of this drug is that it increases the mesocortical dopamine pathway, the dopamine in the mesocortical pathway, which they found treats the negative symptoms and the cognitive symptoms. So the negative symptoms are like social withdrawal, flat affect, which means your facial expressions aren't normal. Lack of pleasure, like you notice listening to the two women who suffered from schizophrenia that obviously even eating, activity, friends, nothing, they were completely like dead to the world. And then a poverty of speech. So in the case of Ellen Sachs, you heard when she read from her diary or from her journal that she clearly could not put her thoughts, express her thoughts. So it's not like aphasia where you're not speaking. This is more like you're speaking, but it's not intelligible. So an atypical antipsychotic like clozapine is going to reduce your positive symptoms, but also is going to help with your negative symptoms. And then the cognitive symptoms, we didn't mention these in the last video, but like attention, organization, planning, those types of things. All right, and then I have a second one on the backside. And I don't know how to pronounce these drugs. You know how they do with drug names. The drug is Aripiprazole. I don't know how to say it. Sometimes you see it in different variations. But this drug is another atypical antipsychotic, and it's a partial agonist. So the first drug we talked about, chlorpromazine, was a antagonist, and then Aripiprazole, I'm sorry, I wish I knew how to pronounce it, is a partial agonist. So what does that mean? Well, it means that this drug, when it's in your system, is the receptors in your brain actually want to bond with the drug more than they want to bond with dopamine. So in that case, they're kind of like an antagonist, but the antagonist just blocks the receptor. This partial agonist, it will bond with the receptor, but it acts like dopamine, but not as powerful. So it's reducing, the net effect is it's reducing how much dopamine is being released, but it works in that different way. And so instead of just blocking the receptor site, it performs a similar function to dopamine, but not as potent. So this also reduces positive and negative symptoms. But not without side effects, right? So if you read in that article, some of these, cause people to have hypertension, which is high blood pressure, other heart issues. They have to have their blood work checked, or Some of them cause people to gain weight or feel lethargic, or, yeah, these are not pleasant drugs. It's not like, you have a headache and you take ibuprofen and your headache goes away and you're like, with no side effects. This is not like that. So, conclusion. These drugs, these antipsychotic drugs, both the early ones, and now the atypicals, have revolutionized the way we treat schizophrenia. So it used to be, like you read, if you had schizophrenia, you might be wandering around the street homeless, or you might be in an asylum, or oftentimes, because we didn't have a lot of mental hospitals, you'd be in prison. Do you remember Dorothea Dix from history class? She was one who brought prison reform because she went into these prisons and found that many of the people in the prison had mental illness, and started advocating for them. So you take a woman like Ellen Sachs, who without these types of drugs, she would be institutionalized. She would not be able to function normally. However, with these drugs and treatments that work for her, even though it's not pleasant, she's a very intelligent woman who's a professor at a prestigious university. And Eleanor Longden is a psychologist. So it's amazing, right? You went from completely incapacitated by a disease to be able to manage the disease. And those are success stories. Certainly there are some people who really struggle with all the different types of medications. None of them really work. Sometimes they work for a while and then they lose effectiveness. And it's just misery. So that's why it's like the worst mental disorder, arguably. So hopefully that gives you an idea of how these drugs, they're really amazing, how they work at a neurotransmitter level, and how they help people who suffer from schizophrenia cope. I also hope that you got from the video, like Eleanor Longden said, I think one of her best lines was the idea, don't tell me what other people have said about you or what's wrong with you, just tell me about you. And yeah, mental illnesses are very stigmatized, and they're extremely difficult to cope with. Obviously, a lot of people who suffer from depression or anxiety or schizophrenia end up committing suicide. And so the more we know, the more we can help other people, and just be empathetic, to be tender to their struggles. And I think that means a lot. Okay, so hopefully that was helpful. Now that we've completed our chapter 18 objectives.